Hi everyone. Now we're going to talk about submaximal efficiency testing. So as I mentioned in the first lecture, we have two different types of common assessments for determining the aerobic or cardiovascular fitness of a client. The first is maximum aerobic capacity, direct or indirect, and the second one is submaximal efficiency testing. So as the words say, it's submaximal. So this is not a maximal test, and you're looking at the efficiency, the metabolic efficiency of the system. So a submax test acts as a good check-in to monitor adaptations to training. So this is a test that you could do once a week in order to assess the changes, the physiological responses to various load or intensities. This is really evaluating that physiological responses to certain exercise intensities. You can either do it in a graded fashion, where you go 50, 60, 70% of max and assess responses, so heart rate, rating of perceived exertion, etc. Or you could potentially even do a time trial. So what's common practice, and what I've done quite a bit in the lab when I want to do submax efficiency testing for athletes, is I get them to sit on a bike or a treadmill at 60, 70, 80% of either their VO2 max that I determine in a direct aerobic assessment or their heart rate reserve. And then what I do for each of those stages at 60, 70, and 80% intensities, I monitor their blood lactate, their respiration if I want to, if I have access to it, their heart rate response, and their perceived exertion or their RPE. And what you should see over time is that those intensities should become easier. So at 60%, instead of having a heart rate of 150 beats per minute, which they had initially, they may be down to 140 beats per minute after 6 weeks of training. That's an indication that their body has become more metabolically efficient at delivering, utilizing, and taking up that oxygen. So there are many different examples of submaximal efficiency tests. There's not one that's perfect. You just have to use the same one over and over again. You might actually pick your own, which may be just 10 minutes at 70% of someone's heart rate reserve or VO2 max. And you see in that 10-minute period how their heart rate response is and their RPE. And you see how that changes from week to week of training to gauge their adaptations to cardiovascular training prescription that you're giving them. Some other examples are the YMCA submax test and the Astran submax test. Now, these could be maximal tests, but in this case, they're submaximal tests. And both of these tests are also indirect aerobic capacity tests, as they use predictive equations to determine and predict VO2 max with their results. So one area that's very important to understand is the difference between validity and reliability, which was discussed in a previous lecture. This is really important when it comes down to picking a test, that all tests have limitations and advantages. They may not all be valid, completely accurate, but what they are is reliable over time. They will provide you with a number over time, a change in performance over time. So what you need to do to maximize validity and reliability of the results is to pick a test and be consistent with using it as your testing modality for each assessment time. Okay, so at baseline test, you use this test. 4 weeks down the road, you use the same test. 6 weeks down the road, you use the same test. 8 weeks down the road, you use the same test. It's not valid and reliable to switch tests every single time. You want to ensure that the test is executed and you do it properly and you have the same stages and you do it exactly the same every single time to maximize validity and reliability. So this means that you need to ensure you have standards in place to minimize intra-subject variability, inter-subject variability. So some things could be arrive at the same time of day, right? After you ate a breakfast, which is typically the same one you eat prior to every test session. So control for time of day, control for diet, control for environmental conditions, control for the same tester. So this is the inter-tester variability. Make sure that the tester or assessor is the same person because we each bring our own bias to how we do things. and intra-rater variability. We want to ensure that my bias within myself is fine-tuned and I test the same way each time. I provide the same amount of motivation each time we do the test. I'll provide you an example here. When I was with Hockey Canada for 10 years, there were so many variations in different tests, and it was extremely frustrating. For example, we were tested on pull-ups quite regularly. And if you were in Toronto, you weren't allowed to use your lower legs to provide momentum for doing a pull-up. But if you were in Quebec, you could use your legs. So the people in Quebec could do 10 to 15 pull-ups, while in Toronto, we couldn't get more than 7 to 10. So it looked like the people in Quebec were doing more upper body training and were more fit from an upper body muscular strength standpoint, when really it could have been just bias in how the test was administered. Likewise, when it came down to the beep test, we were tested on the 20-meter Leger beep test every time we met, which was 3 to 4 times a year. The distance that was measured was different in different locations. And it provided a huge area of frustration because in one area it would be 15 meters instead of 20-meter shuttle test. Or it was so variant, and as a result, it would decrease the validity and the reliability of that testing because your results would be better one time with a shorter distance and worse the next distance. So this is so important that you pick a test, that you execute it the same way with the same controls in place every single time to maximize validity and reliability of that test and ensure that the results are actually determining what they're supposed to, which is seeing if your client actually improved. So now let's have a reality check. We've just gone over a needs analysis. You've conducted an assessment for cardiovascular fitness, either a direct or indirect test, either a maximum aerobic capacity test or submaximal efficiency test. Now you've collected all this data. What do you do with it now? And that's what we're going to go into on the next few slides. Now let's recall the goals of program design that was discussed last week. The first is injury prevention. We want to be able to prevent injuries. So whatever program you're designing for your client, you want to ensure that you're targeting the areas that are specific or more prone to injury and making them strong. So injury prevention is huge. The second is you want to enhance the ability to tolerate demands of everyday life, of their athletic events, whatever it may be, through developing system capacity and structural tolerance. Okay, so that has both a metabolic component, but also a structural component as well. And then the last goal is to enhance performance. Now, performance is dependent on their lifestyle. So it could be improve or enhance performance or recovery of tasks of everyday life. It could be for a special population to enhance athletic performance. It could be also occupational demands performance. All of these things, it needs to be relative to your client. But these are the three main goals of program design. I just want to recall this optic of a gap analysis. So we have our current state, and then we have where we want to be, that happy face, and that's the gap. And from within that gap, we have key steps to bridge the gap. The desired state, that happy face, is the normative standards for health for that age, population, that gender, that ethnicity, whatever it may be, and or your gold medal profile for an athlete. Okay, so this is the gold medal. This is a gold medal performer, and this is my current state. This is the gap I have in order to get to that gold medal performance. And from there, from the gap analysis, you create the action plan, which really drives your program design. So here's an example of normative standards for maximum oxygen uptake, norms for men, age 18 to 65 plus, and women age 18 to 65 plus. And as you can see, we have very poor all the way to excellent and standards for them in relative terms. So milliliters per kilogram, incorporating body mass per minute. So you can classify your clients' cardiovascular fitness based on these normative standards. So essentially you compare their data to published data for that specific population for sex, age, ability, and sport. And you either classify them as below average, average, above average, or as a percentile. In this case, in this chart, we see very poor all the way to excellent. So once we've classified an individual, this helps us identify their strengths and areas of improvement for goal setting. So let's run through an example here. Polly is 35 years old and has a VO2 max of 38 milliliters per kilogram per minute. If this is the case, if we go on to the bottom table, she's 35, we go to 35 years old and go down to 38 milliliters per kilogram per minute, Polly would be classified as average aerobic fitness level for her age and for her gender. So it also is very important to classify based on the ability level of your client. So here on the right side is athlete population normative standards for maximum oxygen uptake in relative terms in various population groups. So as you can see, there's basketball, baseball, cycling, canoeing, football, gymnastics, ice hockey, a whole bunch of different ones. This is not fully up to date, so you want to ensure that you look at the most up-to-date normative standards for an athlete population. Sports specific is very important, that obviously you don't want to compare cycling to ice hockey because the requirements, the aerobic requirements, are going to be different for each person. And then what you identify is what is the aerobic fitness requirement? What is the minimum, the mean, and the max for the sport? So if we look at cycling on here, it says anywhere for males between 62 and 74 milliliters per kilogram per minute. So that typically is what you would need as a basis for aerobic fitness. And then you want to determine your classification. Are you on the lower end of this? Are you at the upper limit? What is required by your sport in order for you to be competitive? Here's an example of Triathlon Canada's gold medal profile. So as you can see on table 4, these are world-leading run performance standards achieved on track or road under the International Athletics Federation rules. Okay, so what for men, we see men for 5K and 10K and women for 5K and 10K. And if you click on the link below for Triathlon Canada, you can see which progression you should be on and what your time and how it classifies to world performers. So for example, if a male is running a 5K in a time of 14 minutes and 52 seconds, he's 92nd percentile for his ability to run the 5K in the world. Okay, so you can classify yourself from an athlete perspective based on these gold medal profiles and see what your gaps are for triathlon, which this is used for selection, but also for goal setting, and also to determining the athlete profile for each of your clients. Now let's run through an example of a general population male who is age 40. So as you can see on the left row, we have assessment, then we have his actual data, his healthy age norms, the difference or the gap, and the goal. So let's run through a gap analysis here. So the assessment firstly is an indirect VO2 max test on a treadmill. His score, or what he actually achieved, was a VO2 max of 29 milliliters per kilogram per minute. Healthy age published norms for this individual is between 45 to 48 milliliters per kilogram per minute. This is considered to be that high end of average. So what's the gap? If his goal is to be on the high end of average, we subtract the healthy age norm from his actual. So 48 minus 26 is a gap of 22 milliliters per kilogram per minute. So his goal would be improve aerobic fitness, so bring it to 39 milliliters per kilogram per minute in 6 months. So that's approximately a 34% increase. And as we mentioned in a previous lecture, you can see 10 to 30% improvement in aerobic capacity within the first 3 months of cardiovascular training. So this is an achievable goal for this individual. Now let's look at his BMI, body mass index, which isn't a great indication of his overall health, but it is okay for our purposes for this gap analysis. His actual is 30 BMI, healthy age norm is 25, so a difference or the gap is 5 BMIs. So the goal may be lose 20 pounds or lose 20 pounds in 6 months. So that's 1.5 pounds per week, which is in line with the American College of Sports Medicine achievable and healthy weight loss. So that would be his goal. Then his skin folds percent body fat is 26. He's currently at 26% body fat. Healthy age norm for a 40-year-old is 18% body fat. The difference, the gap, is 8%. So if he did drop that 20 pounds in 6 months with exercise and nutritional intervention, he would probably be at 20% body fat in 6 months. So this would be how an individual, yourself, could do a gap analysis. I like to make a chart like this, do your assessment, find their actual data, compare to healthy age norms. The difference or the gap is calculated, and then you make a goal based on that gap. Here's the normative chart for body composition based on percent body fat as a result of the American College of Sports Medicine's position stand on body composition. So you can see the men's norms on the top and the women's norms on the bottom. And this is what I used in the previous example on the previous slide to classify that individual's body composition. So you can use this when we move forward to the labs and we're looking at percent body fat and skin fold assessments. This is the normative chart that you can compare the results to. Let's run through another example of a gap analysis. So this is for a female marathon runner. So the assessment, first of all, is a VO2 max test. Her actual score is 70.4 milliliters per kilogram per minute. The race winner of the marathons that this individual has been at is 79.2 milliliters per kilogram per minute. So there's a significant difference in VO2 max. And as we know, VO2 max is a predictive performance variable that impacts aerobic capacity. So the difference is approximately 12%. Okay, so a goal may be through more cardiovascular training to improve the VO2 max. So we also tested this individual in metabolic efficiency, her lactate profile. And we showed that her lactate profile occurs at 65% of her VO2 max. For the race winner, their lactate profile, their max lactate, occurs at 85% of VO2 max. So there's a significant difference here of approximately 20%. So the goal would be to improve her metabolic efficiency by 10% by next summer. So that's 6 months. And remember, this is already an elite marathon runner, so it's all about marginal gains. So 10% may not seem very much over 6 months, but for an already trained marathon runner, this is quite a big change. So the focus would really be, although we see a difference in VO2 max of 12%, by improving metabolic efficiency, you will indirectly improve VO2 max. So the goal really is to improve the biggest gap for this individual, which is metabolic efficiency. You can see the best time of last year was 3 hours and 5 minutes and 10 seconds, while the race winner was 2 hours and 27 minutes and 11 seconds. That's a difference of 38 minutes. So her goal, an achievable goal, is to shave off 10 minutes by fall of 2018, which is almost a year. So that is considered doable in a year. And then also we looked at her efficiency as an assessment. She had a rigid upper body, long strides. The race winner, when we compared that individual for their efficiency, they had a supple upper body, higher frequency stride, and shorter stride length. So the goal, therefore, is to work on relaxing the upper body through self-talk, improve stride length, and then work on the frequency. Okay, so this is only one component of performance. It's a physiology piece. There's other performance factors as well. But this is how you would do a gap analysis on a professional athlete or an elite athlete. You do the testing that's appropriate for them. You can collect their actual data. You compare to either the race winner or the gold medal performers within that field. You determine what the gap is and what's the most important gaps to close. And then you create goals from that. So with the program, this really drives program design focus. For this individual, it would be improving her lactate profile and metabolic efficiency through changes in stride length, which will indirectly improve aerobic capacity.